common complaints. It's a little bit similar to where we said the pain was, but I was alluding to, and I want to elaborate a little further on the pain that's in the jaw joint itself.
Mhm,
I think the classic TMJ disorder that we see
mhm,
is somebody that goes to open the jaw and they feel like a click and a painful pop
mm,
right there in the joint of the jaw.
mhm,
And that is probably the classic sign that if you're like opening, you're chewing food and you could hear clicking, grinding, and it's associated with
mhm,
pain, and that pain zings up into the head here, or it zings down the jaw.
mhm,
Um, it's time to come get some help from a
mhm,
physical medicine provider like Ben or myself at that point.
mhm,
That's a pretty common complaint.
mhm.
What other types of common complaints do you believe we see, Ben?
Well, some of it could even be, um, te like feels like dental pain,
Oh, yeah.
almost, but it's, but sometimes it's not anything necessarily with the teeth or anything
Hmm.
like that. Sometimes there's just there's a trigger point somewhere, probably in like the masseter. So then you can release those, and then that really helps a lot. Um,
Yep.
and it's and but usually those trigger points in the masseter, they don't like typically refer, like up into the up into the head, or
Hmm.
into down into the clavicle, or what have you. But sometimes they do. So
Okay.
a lot of times they're like localized to there. So
Yes.
there can be a lot of different stuff going on there. But yeah, I mean commonly it's, yeah, it's just kind of like pain, and people report just having like pain or tension in the neck and the jaw, with usually usually stress
Yep.
related, or they're just kind of in that like
Yeah.
holding pattern in front of a computer or something.
I hear you.
Yeah.
And I two things I love what you said. You
Mhm,
mentioned tension, right? So I know we were talking about
mhm,
pain, but sometimes part of the common complaints is not necessarily high level pain, but just like,
mhm,
wow, I feel so tight in my jaw.
mhm,
Um, that could be the you leave that unchecked and then you could cross over the line to start to feel pain later.
mhm,
Great point that you brought up with like the dental, kind of feeling like there's maybe something at the tooth level,
mhm,
because this is one of those where sometimes people maybe sit and think to themselves, how could a dentist be connected to a massage therapist or
mhm,
chiropractor? Like, what's
mhm.
the connection?
Yep.
This is it right here. So there are times where it's actually a two-way street, where we have somebody that comes in and we think, hey, this is TMJ disorder. We get evaluating, we get inspecting, and then we realize, like, you know what? This doesn't seem right. Did you go into your dentist, and when's the last time you've gone, and have they checked for like an abscess tooth or like a cracked tooth or something? And
Mhm,
then lo and behold, they schedule within a couple of weeks to their dentist, get an x-ray, and it was a
mhm,
tooth that was mocking like a TMJ disorder.
mhm,
But it goes back the other way too. We've gotten referrals. I know I have gotten referrals from dental providers where they say somebody was coming in and kind of complaining of tooth pain, but they checked it out and they're like, there's
mhm,
nothing wrong there. You might have TMJ. How about you
mhm,
go have a couple of appointments with like a
mhm,
PT or a chiro and have them work it up and see if that's the
mhm,
cause of your pain. So
mhm,
sometimes this area could be a little tricky, and that's
mhm,
where it's nice that we have good relationships with our dental providers in town here, where we can pass it along when we're pretty confident that it's not really TMJ and that it's actually a
mhm.
tooth problem.